apnea is a respiratory disease that happens when you're asleep. If we break it down, it's most commonly called obstructive sleep apnea, which is an individual's airways obstruct whilst they're asleep. When we say obstruct, your airways are a nice big tube, and then when you're asleep, they close, which is a normal thing to happen in an adult. And in a normal adult, we do it 5 times an hour without any problem. In other individuals who suffer from obstructive sleep apnea, they do it for more than this. So they do it more than 5 times an hour every night, and it makes their oxygen levels drop, makes their heart rate increase, and eventually wakes them up. It can cause uncontrolled heart disease. It can make diabetes very difficult to control. It causes cognitive problems such as low mood, memory, loss of concentration, and it can become quite a significant burden on a patient's home life, as it puts strain on the marriage because there's normally associated snoring as well. The individual may start to struggle at work. If they're studying, they start to fall behind. So it can have some real profound effects on the individual apart from just the medical problems. Yeah, it's much more common than people think it is. So about 2% of women and 4% of men suffer from it. Apart from when women become postmenopausal, that's 4% of them as well. So menopause in the women, unfortunately. Weight gain, high weight, it can become a problem in pregnancy and lead to preeclampsia. Patients that have any sort of anatomy difference in their jaw, it can cause problem with. So patients with Down syndrome could be particularly affected. There are individuals that naturally just have large tonsils or large tongues, and if you have a large tonsil or tongue, that will block your airway much more easily than somebody with a smaller tonsils. So in Powys this month, we're going to start a sleep diagnostic service. With the funding from the North Powys project, we've managed to secure equipment to test these individuals, and we are now able to provide a sleep service, diagnostic service, to all of the residents of Powys remotely, so they don't have to come to one particular hospital. We can treat them, we can see them close to their home. And we've also managed to get Pavo on board, who have a hub in North Powys. So any individuals that aren't very confident with technology, that need that little bit more assistance, can access it. So GPs refer patients with suspected sleep apnea to our service, and as a result of that referral, we will ring them up, speak to them about the referral, we'll take a history, and then we'll have a video consultation with them to demonstrate the equipment and get a full history. They then send the equipment back to us, and the results go back to the GP. This then enables the GP to either refer that patient onto a sleep clinic to get treatment for their diagnosed sleep apnea, or reassures the GP that there is nothing wrong, and in some cases we'll even be able to signpost to other services that might be relevant to the individual.